The sterile line change protocol was introduced at Mount Sinai Hospital Neonatal Intensive Care Unit in February 2012. After a thorough review of the literature and current practice, the unit made a dramatic change in central line care for the most vulnerable patient. The Center for Disease Control and Evidence-Based Practice for Improving Quality recommends using sterile line change technique when handling central lines. A central line is a sterilely inserted catheter used to deliver fluids and life-sustaining medications, which can stay in the infant for a few weeks. Since the new practice was implemented, it has greatly reduced infection for these tender babies and not only improved the outcome of premature babies, but ultimately saved lives. For the purposes of education, we are using a prop instead of an infant. Changing a central line in this manner requires 2 nurses, one nurse who will handle all sterile supplies and one who will handle all of the non-sterile solutions and equipment. To begin, the sterile nurse gathers all supplies for the line change. They are left in the packaging for now. For this procedure, a nurse gathers 2 sterile towels, 2 packages of 4x4 gauze, 1 10cc preloaded normal saline syringe, tubing and T-pieces, chlorhexidine swabs, IV solutions from the order, sterile gloves, and a gown, hat, and mask. Next, the sterile nurse scrubs her hands for 2 minutes, an important step that cannot be missed. She then puts on her hat, mask, and gown, protecting her environment from possible transmission of germs. Then she takes the sterile towel by the corners and places it on a clean surface. She opens all supplies, finishing by putting on her sterile gloves. This is when the second nurse joins in and also dons her hat, mask, and gown and washes her hands. The 2 then join together to assemble the supplies in a sterile fashion. The sterile nurse connects all of the tubing while the second nurse handles the IV solutions. After they connect the tubing, the sterile nurse then purges the tubing, making sure no air is present. Once the equipment is ready, the second nurse opens the incubator. The sterile nurse then takes the second sterile towel and places it into the incubator. At this time, the second nurse removes the syringes and the IV bags from the pumps. The sterile nurse then wraps the sterile gauze around the non-sterile tubing and takes a chlorhexidine swab to scrub the connection for 30 seconds, a phrase the NICU has now adopted as scrub the hub for 30 seconds. She then disconnects the current IV tubing. The second nurse now hangs the new IV bags and places the new syringes in the pumps. The sterile nurse scrubs the connection again, and then she attaches the sterile tubing. After this is completed, they close the incubator and clean up supplies, take off their protective equipment, wash their hands, and finally they place a blanket over the incubator for developmental care. This one process the NICU has coined the line bundle of practices. It takes only a few minutes but can have long-lasting effects.